Hello, I'd like to share some information with you today in regards to psychotherapy and what it is. So, this information today is coming from psychiatry.org from the American Psychiatric Association. The physician review, it was by Rana Parekh, as well as Laura Givon. So, what is psychotherapy? Psychotherapy or talk therapy is a way to help people with a broad variety of mental diagnoses and emotional difficulties. Psychotherapy can assist in eliminating or controlling troubled symptoms so a person can function better and increase their well being and healing. So, problems helped by psychotherapy include difficulties in coping with daily life, impact of trauma, mental illness, and/or loss, like death of a loved one, and specific mental disorders, such as, for example, depression and/or anxiety. There are several different types of psychotherapy, and some types may work more in conjunction with an individual based upon the treatment goals that you all are creating and working towards. Psychotherapy may be used in combination with medication or other therapies. So, what are therapy sessions? Therapy may be conducted in an individual, family, couples, group setting, and it can help both children and adults. Psychotherapy can be short-term, which means a few sessions dealing with immediate issues, or long-term, months or years dealing with long-standing and complex concerns and issues. So the goals of treatment and arrangements for how often and how long to meet are planned jointly between the client and the therapist. Psychotherapy and medication. In psychotherapy, it can be used with a combination of medication treatment for mental health conditions. In some circumstances, medications may be useful, and in other psychotherapies may be the most optimal option, and not always, though. It does vary from person to person, case to case, client to client. Healthy lifestyle improvements such as good nutrition, healthy exercise, and adequate sleep can be important in supporting recovery and overall wellness. So, does psychotherapy work? Psychotherapy has been shown to improve emotions and behaviors and be linked with positive changes in the brain and body. The benefits can also include less distractibility, fewer medical problems, and increased work satisfaction. To help get the most out of psychotherapy, approaching therapy as a collaborative effort to be open and honest and follow your agreed upon plan for treatment can be of assistance. Following through with any assignments between sessions, such as writing in a journal, practicing what you all talked about or discussed within the session, can also be of benefit. So there are different types of therapy. So psychiatrists and other mental health professionals, like counselors, like social workers, therapists, use several different types of therapy. The choices of therapy type depends on the client's particular diagnosis and circumstances and the person's preference. Therapists can combine elements from different approaches to best meet the needs of the person receiving the treatment. So, there's CBT, or cognitive behavioral therapy, that helps people identify and change thinking and behavior patterns that are harmful and or ineffective, replacing them with more accurate thoughts and functional behaviors. There's also IPT, interpersonal therapy, that is short-term form of treatment. It helps individuals understand underlying interpersonal concerns, issues that are troublesome, like unresolved grief, changing in social or work roles, conflicts with significant others, and problems relating to others. There's also DBT, which is dialectical behavior therapy. And that's a more specific type of CBT that assists in helping regulate emotions. There's also psychodynamic therapy, which is based on the idea that behavior and mental health well-being are influenced by childhood experiences and inappropriate, repetitive thoughts or feelings that are unconscious outside of the person's awareness is what is worked on. There's also psychoanalysis. It's more an intense version of psychodynamic therapy. Sessions are typically conducted 3 to or more times a week. So it's more intensive. There's also supportive therapy, which uses guidance and encouragement to help clients, individuals, people develop their own resources. It helps build self-confidence, reduce anxiety, strengthen coping mechanisms, and improve in social and community functioning. So there are many of array of therapeutic services. Some other ones that I'm not necessarily going to focus on are animal assistance therapy, as well as creative art therapy and play therapy. So I definitely would say and encourage you, if you are seeking any assistance, if you're feeling like you would like to continue on building on goals, if you are noticing that you're experiencing some symptoms of and needing some support, and maybe possibly trying to figure out, do I need support? Definitely you can have or contact a therapist, ask for possibly, a consultation, speak to what their treatment modalities are. And generally, like I've said before, you could do a Google search, put in your zip code, and see where there are therapeutic services within your area. I hope this information was of assistance. I hope you have a good day.